And welcome back to the morning show. Time to talk with the doc. Oh, I like that.
Hey.
Let's talk with the doc.
That sounds
Dr.
good.
Christine is here this morning. Good morning.
Good morning to you. How you doing?
I'm well, thank you.
Well,
don't
if
know
I
why
sound
don't-
a little bit, deeper voice, it's because I've been
Because
doing.
you're being sexy?
Well, I can always do the 1-800 numbers. Hello, big boy.
There, yeah.
That type of thing.
Let me give you my number while we're at it.
Okay, all right. No, people are coming in sounding like this. Can you believe it?
Yes, I can because I just got over a cold myself.
Right, right. What we haven't seen in the office yet is flu. A lot of
Really?
people come in and they think they have the flu, but in reality, all it is more upper respiratory allergies,
Right.
colds, and I just wanted to put it out there that right now that it can start as just a viral type of infection, but then it gets it can get very aggressive.
Right.
And my concern are for the children and for people who have lung disease like emphysema, bronchitis, and don't let it go too long. The first 3 days, if you can catch this little sniffles that you have in the first 3 days, a lot of times people are start using euthanasia. They can start using vitamin C, emergency.
Right.
I totally encourage that,
Right.
honestly, because you can nip it in the bud.
Right.
Right, so that way it doesn't progress into longer and longer time spans.
Right.
But one of the first things that I've also noticed is a lot of people are coming in because they're so concerned, their babies, or for that matter, people are coming in because of nosebleeds. And they think,
Right.
oh my, something's wrong, hypertension. Yes, can hypertension cause a nosebleed? Yes, it can. But you know as well as I do, living in the desert, and for people who are visiting us for the first time, is basically, if you start having a nosebleed, please put a humidifier. I don't care if it's a cold humidifier or if it's a hot humidifier. Just get that moisture back in the air, because a lot of us will have nosebleeds just because of the dryness of the air here.
Right. Right. Absolutely. And it's, you mentioned those remedies, and many of which I use, because the second I feel a cold coming on, I start dumping about 3,000 units of C three
Right.
times a day. Just start plugging them, because I have heard, you can verify or deny, but I've heard that your body will use as much as it can, and then the rest of it just gets rid of your vitamin C. It's not going to hurt you.
No, that's true. That's true. I mean, you can't use mega doses,
Right.
but what you're using, no, absolutely not. And a lot of times today, if we can just boost our immune system, then that by using either antioxidants, and antioxidants would be any colorful fruits and vegetables. If people can just boost our immune system by using those various things that we talked about before,
Right.
definitely that can help at least lessen the amount. You're using decongestant, you just got to be careful that if you have high blood pressure, some decongestants
Right.
can raise the blood pressure. So if you have a blood pressure monitor, definitely go ahead and check your blood pressure to make sure these medicines aren't having an effect on you. I kind of like the decongestants, but again, that can affect the blood pressures. I also like antihistamines because people say, which ones do I use for what?
All right.
And the key things, if you think it's more allergy based, that's why it's called Allegra D. So I'm not trying
okay.
I'm not trying to boost that one, but if it's look in the back of the package and say, is this for allergies? Or the other one's antihistamines, which are more for sinuses. And other things that I'm seeing out there are a lot of people are coming in, if they have tenderness in these sinuses here, these sinuses up here, you just barely touch them.
Right.
That's a sinusitis. That's even worse. You need to go to your
an infection,
doctor.
right?
Yes, it is. That means fluid is collecting up in your sinuses, and we have what we call a dangerous triangle. And this may look a little gross, but if I go over there and put my hands like a triangle, and if I were to put it inside my mouth,
Yeah.
and you can see it goes from my nose all the way inside my mouth,
Right.
then that is what's called the dangerous triangle, because that goes straight up into your brain.
Oh.
So you can get a meningitis with it. So if you're having this tenderness here, and a lot of times you'll see us do this, tapping on our sinuses, and I'm showing you this, you can
Right.
do it to yourself, and if those are tender, you really need to go to your doctor, because you may need an antibiotic versus someone who is just having just like plain little cold. The other thing that I always tell my patients that, say for example, if they're having, just clear or white discharge coming out of their snot, their nose, or their
It's better than some of the things we've spoken of here. It's not a
Sure.
problem.
Or if they're looking in the back of their throat and then all of a sudden they're coming up with some sputum and it's turning colors, yellow, green, please go
Then
to
you got
your
a problem,
doctors.
yeah.
Right. Versus the clear stuff, that's just more viral type of infection. And a lot of people expect that when they see the whitish or the clearest that we should automatically give you antibiotics. And you're going to see that we're running out of antibiotics. Okay, there's just a certain limit of antibiotics that we have. So we're trying to not be mean to people, but and it always happens on a Friday that people are coming in because they're sick. But if you notice that you've been sick probably on a Monday or Tuesday, please try to
couldn't
get
miss
into
work.
your doctors, because then all of a sudden you're going to end up being in the emergency room or the walk-in clinics. You can be there for hours upon hours upon hours. There's many of us that open up our doors for people, like for emergency visits, to come in straight in.
Right.
So that they can be seen and that we can take a look and see. Sometimes if you're really coughing and really hacking up, especially if you're a smoker. Say, for example, people who are trying to stop smoking. All of a sudden, you're going to see them really coughing a lot more than what they normally do. And the problem child is that when they smoke, they paralyze the little cilia, the little hair-like projections that are in our lungs, and it stops the cough.
Yeah.
But as soon as they start trying to stop, they're just trying to clear out their lungs.
Sure.
So it's the body trying to eliminate all the toxins.
Let me ask you one question, and I confirm or deny. Lynn has, every time I start coming down with something, besides the vitamin C, and just watching over me very closely, start me on Zicam.
Yeah.
It seems to be effective.
Yes.
Okay.
Yes.
Okay.
Yes, zinc and Zicam and all those things, I totally promote it.
Okay.
Because the whole idea, it's not going to hurt you, and the whole idea, it's about catching it early. That's probably, if I have to say one thing, as soon as you think, say one person in your family gets it, oh my gosh, the whole rest of the family is going
Right.
to get it. And right now we have a lot of visitors coming in from other states.
Yeah.
So here we are used to Bullhead, Laughlin, and Needles, California germs.
Right.
Okay, and then all these people are coming from Washington, from Iowa, from New York, and whatever. They're bringing in their germs.
Right.
So we're not used to their germs. So here we go, getting sick or
Right.
sicker than what we normally do.
And so you've got, I mean, this is kind of like, you've gotten in an airplane, right? And that cylindrical tube with all these different people from every part of the world sitting in there with you with every type of disease that could be known to man. And it might not even be a bad idea, especially depending on age and how you've been feeling lately, to kind of help beef yourself up with vitamins, et cetera, before you ever climb on an airplane.
Oh my gosh, absolutely.
Yeah.
And then get those bacterial wipes, be that monk, and then when you cough, remember, I'm seeing people forgetting that universal cough sign where you're supposed to do this.
Right.
And I'm not seeing that. I'm just seeing people coughing and coughing out and giving us all their little germs to say hello to us, especially in a grocery store.
Yeah.
Please,
Right over
please,
the
please.
tomatoes.
I
I
almost
feel
want to
that.
go over there and give them a mask. Or maybe I should wear the mask. I'm not sure yet, because I don't want
That's the better bet, I got to
I
tell
know,
you.
I know. I do not want to wear one, but it's like, wow.
30 million Japanese can't be all.
Well, you know what? I saw at the airport? There were some Japanese people there, and it was awesome. They all had this little device that they were breathing into because they were sick. And so
Really?
they were breathing into this thing, and they had an air thing so that they wouldn't give it to other people. I thought that was so nice.
Now, are you sure they were sick or they didn't want to be sick?
Well, no, some of them sounded like they were,
okay.
they sound like I do when I have a hoarse voice.
Really?
Yeah, yeah. I never had seen anything like this.
It's a very considerate civilization, isn't it?
No, I know. Everybody else was just
I haven't
splurring
seen
out.
that around, yeah.
Absolutely.
Hey, yeah, I want to thank you very much for coming down.
Oh,
I
absolutely.
feel better. You
Yeah,
seem
good.
like you're doing okay. It's just kind of a,
Yeah.
in the background.
I know. Didn't it sound? It's all nasal. Yeah.
That's kinda-
It sounds sexy.
Can you call me later?
Yeah, sure.
Fantastic.
All right.
All Wellness Medical Center, ladies and gentlemen, Dr. Christina. And she can call, well, I don't know if she's going to have to call you. However, you need to call that office and get an appointment and get on in there, men and women. Thank you.
Thank you, sir.
We'll be back with more of the morning show right after this.